Hey, and welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Glidewell Dental.
And today we are finishing up Dr. Chi's three-part case. He was replacing some PFMs on number 7 and number 10, and he was replacing them with BruxZir Esthetic crowns, which are beautiful and strong. So what's this final third part?
Well, Megan, it's a three-peat. Today, Dr. Chi is going to cement these crowns, but also, to finish this case beautifully, he's going to be doing a composite on tooth number 8.
Awesome. Let's see the final restorative result.
Thanks, Will and Megan. Welcome back for part 3, where I'll take you through the final delivery of the BruxZir Esthetic crowns on tooth numbers 7 and 10. Once the provisionals are off, I begin working on redoing most of an existing over-contoured and discolored facial and distal facial composite restorations on number 8. I like using a carbide slow-speed round burr to remove the old resin to help minimize the removal of healthy tooth structure. Once the areas are prepped, I proceed with the total etch bonding protocol. Etching first with 37% phosphoric acid for 15 seconds, followed by Kerr's OptiBond Universal Adhesive, and then restore with Camouflage Nanohybrid Flowable Composite shade A2, using a clean explorer to mold the composite into position. I prefer flowable for many low load bearing areas since it adapts well to the cavity. If using flowable to restore larger cavities, it's important to still build up and cure in smaller increments since polymerization shrinkage is typically greater with its lower viscosity. Once cured, I use a fine grit tapered diamond for bulk refinement, followed by Venus Super Rubber polishers to ensure the margins blend seamlessly to the surrounding natural tooth structure. If they aren't smooth, staining can easily occur along the edges. To dispose a bit more of the prep and protect the sulcus from excess cement, I pack a size 000 cord around both 7 and 10. If placing cord before cementation, ensure it's packed deep enough beyond the margins. Otherwise, cord getting trapped under your restorations would be a very bad day at the office. After try-in, we clean the restorations out with IvaClean to remove any salivary phosphate contaminants that can interfere with the bonding of these restorations. We allow the IvaClean to interact for at least 20 seconds, then rinse and dry. We then apply a very thin coat of OptiBond Universal inside the restorations to act as a primer for the zirconia. Once the restorations are cleaned and primed, I begin prepping the teeth for bonding. While the preps are retentive enough to use a conventional cement such as a resin-modified glass ionomer, I recommend using an adhesive resin cement with more translucent restorative materials like BruxZir Esthetic in the anterior. The opaque white nature of RMGIs could potentially show through thin restorations and affect light transmission through the tooth, resulting in darker soft tissue. To disinfect the preps, I apply a very thin coat of Gluma, carefully avoiding the soft tissue. Any excess can be removed with a high-speed suction or a dry microbrush. Then OptiBond Universal Adhesive is scrubbed on both preps, air-thinned, and cured. The restorations are loaded with clear Kerr NX3 adhesive resin cement and then seated into place. With a tack cure of about 3 seconds on the facial and lingual, the excess cement enters a gel state for easy removal. After flossing to remove any excess interproximally, we final cure for 20 seconds per surface. Adjustments to BruxZir Esthetic can be made with a fine grit diamond burr and then polished smooth with a diamond impregnated polishing wheel. Here I use polishers from the Venus Super Kit. Well, that concludes the treatment process for this case. The patient was very happy with the new restorations, even commenting that the results exceeded her expectations. If you're seeking an uncompromising material for strength and translucency, BruxZir Esthetic is just that. I look forward to sharing more transformations with this amazing material in the future.
Well, thank you so much for that, Dr. Chi. This was a great case, and it's always a pleasure to see you in action. Now, if you missed the first 2 installments, visit chairsidelive.com and catch up.
I think it's a good idea. Well, for this episode, we're all wrapped up for today, but on behalf of everyone here at Glidewell Dental, thank you so much for watching.
And we'll meet you right back here next time.